Well, hey, deep divers. Are you going through a nervous breakdown? I gotta say, I think I have between quarantine, not being able to go to the gym, working from home. I gotta get my finances in order. Where is my career going? My grandmother's asking me, when are you gonna get married? When are you gonna have kids? And if I just sit through another Zoom meeting, I'm gonna lose it. I'm going to lose it. The COVID-19 pandemic has brought on enough challenges to make anyone want to crawl into a dark room and throw away the key. And while the vaccine is here and we are seeing the light at the end of the tunnel, the darkness for many of us continues. So what exactly is a nervous breakdown and what are the signs you need to know? I'm Buki Alikbade, and let's take a deep dive. But before we do, make sure you give this video a like, subscribe to the Health YouTube channel, and click that little bell to get notified when we post new content. If you've ever felt on the verge of a nervous breakdown, you're not alone. According to the CDC, Americans have been 3 times more likely to feel anxiety and depression since the beginning of the pandemic. But you'd be surprised to know that a nervous breakdown isn't even a clinical term. Here is Dr. Sue Varma, board-certified psychiatrist and clinical assistant professor of psychology at NYU Langone, to explain.
A nervous breakdown really is a colloquial term, right? It's not a medical term or clinical term, but it's really a catch-all concept for when a person's ability to cope with stress has become overwhelmed.
Because a nervous breakdown is a wide-ranging term that can reference a number of psychological ailments, it's difficult to pinpoint the exact causes. A number of things can contribute to what might be referred to as a nervous breakdown.
What may cause a nervous breakdown for one person may not cause it for another. It is such an individual situation, and it really has to do with what the person has been through in their life, right? Now, it could be a big stressor, like a life change where somebody has had a loss of a loved one or a breakup or a job loss, but it really could be any number of triggers where a person is trying to cope, but at that point in time is really struggling to.
Varma says since our bodies and minds respond to stress in different ways, and because a nervous breakdown isn't a specific clinical term, symptoms will vary from person to person. Here are 7 signs to keep an eye out for. Number 1, stress and anxiety. We have all felt stress and anxiety, once or twice, but stressing over an exam or even feeling overwhelmed about a fight with a loved one would not constitute a nervous breakdown. To differentiate between normal everyday stress and a more severe case, Varma explains.
So it's not enough to say, oh my God, I'm so stressed out, I'm overwhelmed. On some level, we all are, but especially during a pandemic. But is it impairing your ability to function? So you're showing up late to work, or you've had to take multiple days off. Are you irritable? Are you snapping at people? Are you having trouble sleeping? Are you having trouble concentrating in a way that it's impacting your work?
Number 2, sleep cycle. The CDC recommends the average adult between 18 and 60 get 7+ hours of sleep a day, but a change in your sleep habits could be another warning sign. Varma says the change in your sleep habits can go both ways.
Somebody may tell you, I feel completely fine. I don't know what you're talking about. I don't have depression or anxiety. And then I ask them, but tell me about your sleep. I haven't slept in a year. And 34% of people have insomnia on a good day. This is talking about having some difficulty sleeping, or either falling asleep or staying asleep. Or they don't want to get out of bed because they don't want to face the day. And there's this idea of depression naps where a person wants to sleep as a form of avoidance.
Number 3, fatigue. Extreme tiredness could also be a clue you're stressed to the max. Varma says you might even feel weakness in your body. Activities you could once do with ease may become increasingly difficult and tedious, and things that used to bring you joy may lose their appeal. That includes sex. Varma says loss of libido is commonly linked to stress. Number 4, change in appetite. Varma says if you find yourself losing your appetite or conversely overeating, this sudden change in your appetite could be linked to stress, anxiety, and even a nervous breakdown. The stress hormone cortisol has been linked to increased cravings, and if you find yourself skipping the salads and going straight for the ice cream, there's a reason for that. Varma says when you're in the middle of a breakdown, you may be less motivated to prep healthy meals because there's less ability to care for oneself in the way you typically would. Number 5, physical pain. Headaches, neck pains, and stomach aches are all related to a potential breakdown. Varma explains.
If a person isn't able to express what they're feeling verbally, if they're not able to share it with people, if they're afraid that they're going to be stigmatized for talking about emotional or mental health problems, we'll see that these folks will end up developing medical symptoms. The body often communicates what our mind cannot. And that is a hallmark of extreme stress.
Number 6, brain fog. It's easy to blame having trouble concentrating on your work or misplacing your keys on having a bad day. But cognitive symptoms can also be related to a nervous breakdown.
When they use this expression, I've lost my mind, it literally is losing concentration, memory, attention, executive functioning. And that's what makes extreme stress so interesting, because you have stress, you end up developing cognitive symptoms, and then these cognitive symptoms impair your ability to deal with the stress.
Number 7, trouble breathing. Shortness of breath and tightness in the chest are some of the most common symptoms of stress and anxiety. Taking quick, shallow breaths can ramp up the body's stress response even more. If you experience trouble breathing on a regular basis, this could be a sign that you've reached the next level of stress, the nervous breakdown. Experiencing one or two of these signs does not mean you should pause this video and call your local psychiatrist. Whether you're experiencing stress, anxiety, or even a nervous breakdown depends on yourself and the situation. If you're experiencing low levels of stress and anxiety and you just feel off, this may be your body telling you to regroup, which could mean getting back on a consistent workout routine, healthier eating habits, and engaging in activities you enjoy, as well as leaning on your support group. The Harvard Study of Adult Development, one of the world's largest studies of adult life, has linked socializing with family and friends to living a longer, healthier, and happier life. If your experience is more severe, and you fit into many, if not all, 7 symptoms, Varma recommends seeking psychological help.
It's important to get professional help because it says it legitimizes your illness, and it says I'm dealing with a medical issue, because that's what it is. And professional help, which includes therapy and sometimes medication, can be extremely effective.
Whether you're suffering from a little anxiety to a full-blown nervous breakdown, it's important to listen to your body and pay attention to the warning signs. In times like these, it's easy to brush things off and focus on more pressing matters. But it's important to note that everyone's coping skills come in different shapes and sizes. Everyone handles stress differently, and their responses to that stress will also be different. And that's okay. The one thing to remember is to never feel embarrassed or ashamed to ask for help.
When 1 out of 4 people will experience it, just look around the room and know that at some point somebody will have it. We have a tendency to share our favorite restaurant, our favorite movie. Why can't we share our favorite mental health treatment experience to say, oh my God, this therapist is the bomb. Let me give you her number or his number, and just talk to them. Don't expect anything. Just have a conversation.
Breaking the stigma of mental illness and living a healthier and freer lifestyle is something we take very seriously here at Health. And it starts with each and every one of us. Leave us a comment below and let us know how you handle stress and anxiety. As RuPaul would say, if you can't love yourself, how in the hell you gonna love anybody else?
Can I get amen up in here?
If you like this video, make sure to give it a like, subscribe to the Health YouTube channel, and click that little bell to get notified when we post new content. Lisa, my co-host, and I will be bringing you new deep dive episodes every week, tackling the health issues you want to know. I'm Buki Lekbede, and I'll see you next time. Stay healthy, deep divers.